It's Fox and Friends.
What's that? Oh, I know what this is. This is the cancer screening RV.
Yeah.
You know, we're going to have a segment coming up about skin cancer. It is the most common cancer. Of all of the cancers that you hear about, skin cancer is the most common. It's deadly, it's dangerous, but it's preventable, particularly if you go and get screened, say, once a year.
Maryland will be here to talk about that as well.
It's going to be interesting because Allison is going to get screened live on the show, so we're going to show how easy and how quickly it is to do that.
I wasn't aware of that. Do I have to take off my clothes?
Possibly, unless we're not testing your clothing. That's for sure.
We're testing your skin.
Okay, good, because it's important. I mean, I am somebody who was a sun worshiper and overdid
until
it
you switched to the moon.
Shore.
So now you're done with the sun. You're
sure. So
the moon.
I do get screened a lot, and I actually welcome the opportunity.
And you know, it affects all pigmentation, so we're going to talk about that
right?
as well.
In fact, it's more deadly in people of color,
That's right.
actually, because it's harder to detect.
So much, Rick. I'm actually disrobing as much as I can on morning television right now because I'm about to have a cancer screening performed on me, courtesy of our guests here. I'm joined by Brittany Leitz. You are Miss Maryland from 2006.
Yes.
I noticed the crown, so that was a dead giveaway. And Dr. Doris Day, who is a dermatologist who's going to be performing these cancer screenings. And skin cancer is sort of a good news, bad news story. The bad news is that it's the most common form of cancer.
Right, and in the past 15 years, skin cancer rates have actually doubled, and they're expected to be over 1.3 million skin cancers diagnosed this year.
And the good news is that it's the most curable if caught early. But how often does that happen? You were a victim of skin cancer.
I was. Last April of 2005, I was diagnosed with stage 2 malignant melanoma.
What does that mean?
Melanoma is a serious and lethal form of skin cancer. So at my diagnosis, my doctors had actually given me 3 to 4 months. And
3 to 4 months to live?
To live.
Because your cancer had been that advanced. Where was your cancer?
I actually have a scar on my back that I can show you.
Wait, a scar on your back? Oh,
yep,
let me see.
across
Oh, I see this. It's a large scar.
It is.
How big was your mole? Did you have a mole?
I had a mole. It was about the size of a nickel, and it was irregular shaped and discolored. And that's the problem, is that most people don't realize that they need to get screened for something like skin cancer. It's so common, and yet it's so preventable. So by having this RV going around the country with Dermatologics and the Skin Cancer Foundation, we're able to do that.
And there's something fascinating about this RV. 3,400 patients so far have been screened in this RV. How many were found to have cancer?
Over a third of them have been found to have some form of skin cancer. Over a third. And these are people who may not have otherwise gone to their dermatologist for a screening.
That's incredible. Okay, how long does it take? Let's start mine.
Okay.
Okay, I only can show you my arms right
which is
now,
not ideal.
but I have some that look suspicious to me. Let me show you. Here is, now I was a Jersey Shore sun worshiper. That has a dark spot in the middle of it, that mole. Does that worry you?
Well, it certainly, I want to see all your moles, but when you have the A, B, C, D, E's, so asymmetry, irregular borders, variation in color, and then diameters for the D. So I would take a closer look at this with my magnifier. So to do a good skin check, you really need a good light and a good magnifier and some time. So I would look at this under the microscope and look at the pattern. Now this one does have a speckled pattern, and it is symmetric. It has very regular borders. So this is something that, to be very cautious in someone who's fair skinned, who has a lot of sun exposure, especially with a background of family history of skin cancer, this I would remove. Okay. And the scar that you would be left with is really tiny. It's just about the size of the mole. It doesn't leave a big scar.
I agree. I've had many, many suspicious moles removed, and it's easy. So people should do that. So folks, gather around. I want to see everybody jump on the RV. You're all going to get screened. Thanks so much for being here, Brittany Leitz and Dr. Doris Day. We really appreciate it.
Very welcome.
Okay, back inside to Kelly and Karen.